I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Today, we are talking about a chilling reality within healthcare, the systemic dismissal of pain, particularly when the patient is a woman, and even more so when they are a woman of color. This isn't about isolated incidences, it's about a structural crisis rooted in centuries of medical bias. But what happens when the hospital that happens to it says that there is no racial bias involved? How do we get accountability? How do we find and get answers? This incident took place at the St. Thomas General Hospital in the emergency department. So Danielle, welcome to the show. Maybe before we get into talking about your experience, maybe just tell us a little bit about your background, what led you into nursing, and kind of what led up to the incident that happened with you.
Yeah, sure. So my name is Danielle and I'm a registered nurse. I've been a nurse for 10 years and I went into nursing because my mom told me to. I actually wanted to be a writer. I wanted to write books and be an author. And she was like, how are you going to make money doing that? So I did it and I liked it and I'm still doing it. So there's obviously something wrong with me. As a nurse, I started my career in long-term care and then I moved up north to Grey County. I worked med surge, emerge, ICU, CCU, step down. Then I moved closer to my family in London. I worked ICU and emerge again. And then I was a manager for a bit. I did critical care trauma. I was an educator for PACU and now I'm an educator for interventional radiology.
Yeah, it sounds kind of like quite the eclectic kind of spread that you've had there. And there's been so many people that have told me similar stories to yours, Danielle. It's like, oh yeah, I was never even thinking about nursing because it's like it's either or, right? Someone's like, I've been called, and then people are like, yeah, I just kind of like stumbled into it, like I was forced. So it was kind of either or. But yeah, you've had such an eclectic background. And I think that, there's always that saying where it's like, okay, so, did you have to do med surg first before you got into all these things? You think you have to, but I mean, I think at the end of the day, experience is experience wherever you end up and you land. Would you say that you like where you are right now? Interventional radiology?
It's not bad. It's different, but I don't like being comfortable. So I always want to try something new, try something different. And whenever I start to get bored, I'm like, it's time for a change.
Right.
So it's not that I hate it.
You're in a prized position. Like I remember hearing people being like, those are the roles that I want to have.
Right. It is very lucrative.
I'm kind of like you, I'd probably say, being too long in any one specific thing kind of gets dry for me. So I'm just kind of like, I just need to kind of switch it up. So I know you're going to switch it up. I know where you're headed. But we're going to take a little bit of a turn because there's another reason why we've had conversations. And I really hate the fact that it has to be this way in nursing. It has to be this way, particularly in healthcare for Black women. And when you first reached out to me, and you told me about what was happening to you, I was devastated to hear that happen. But unfortunately, and I know this really sucks, like not shocked because I had a similar kind of experience with what happened with me, but I don't want to give all the details away because it is your story. So would you be willing to share with our listeners today what happened with you as a Black woman experiencing, support for fertility and gynecological services?
Yeah, sure. So on September 28th, I went to Toronto to have an egg retrieval because my partner and I are doing IVF. And it was a fine procedure. Everything went well. There was nothing untowards after the procedure. We went home. I was fine. On the 29th, the Monday morning at 3 a.m., I woke up on this excruciating pain. And I was just like, okay, well, it's not super bad. I'll just see if I can wait it out. I took some Tylenol and tried to go back to bed. At 6 a.m., the pain was still there and I couldn't move. So I called my husband and he was freaking out because he didn't know what to do and he didn't even know how to call EMS. So I even had to walk him through that while I was in pain and struggling. Anyway, EMS came and it took 2 paramedics to get me out of the bed and into a wheelchair. And then even then I was crying the whole time, just every move or every bump the wheelchair went over, it just felt like a stabbing pain in my stomach. So we got to the hospital to emerge by 6:30 and I was put in a trauma room right away. I gave them the whole history of what I've been going through with fertility, anything that I was on for medications, anything the specialist was concerned about. I gave all that information. So my pain was the worst it's ever been. It was right lower quadrant pain, 10 out of 10. It felt like somebody took a broken knife and was stabbing me in my stomach. So that's how I described it. I was very forthcoming as much as I could. They all knew that I was a nurse. It was like the question I got asked the most while I was there by every single person that I had to speak with. So 6:30, I got Toradol for my pain. That didn't help. The nurses did come in, I want to say like every half hour to 45 minutes to check up on me, but nothing they were giving me was like helping my pain. I did get some Dilaudid, but I didn't know like how much Dilaudid I was getting. I just know that it wasn't helping.
Right.
The doctor came in around 9 or 10 because the nurses said, hey, the doctor can't assess you until we have your pain under control, as if my pain not being under control was like my fault.
But that makes yeah.
So, yeah. So, but they didn't want to give me more medication because they were worried about my oxygen saturation dropping, which it was fine where it was at the time, but they didn't want to put me on oxygen.
Right.
So it was like this weird balance where like we want you to be pain free, but we don't want your oxygen to drop, but we need the doctor to come in and assess you.
Right.
So anyway, the physician came in. He did a point of care ultrasound at the bedside, asked me about my appendix, and basically said that his goal was to get my pain under control so that I could follow up with my specialist. And he didn't have any more ultrasound spots for the day. So that's literally what he told me. And I'm just like, okay, I've worked in Emerge. I know they have dedicated spots, but I know you can also just call the radiologist and say
Right.
like, hey, I have an urgent situation going on. Can you check this out? Anyway, he was pretty curt about no ultrasounds. So I'm just like, okay, I guess we just stay here until my pain's under control, which it never got under control. Like even when I had to provide a urine sample, my husband had to take me by wheelchair to the bathroom because I still couldn't even walk. So around 11 o'clock, a code blue happened, and then we couldn't find anybody. We couldn't find a doctor. We couldn't find a nurse. We couldn't find anybody. And I was just like, okay, well, I'm not getting the care that I need, so I may as well just go see my fertility specialist. So my husband put me in a wheelchair, and we drove an hour to the town over, which is how far away my fertility specialist is. He gave me laughing gas to examine me, so I actually got proper
Pain
management just so he could do an ultrasound, and he confirmed that I was having an ovarian torsion. So he was just like, I'm sorry, but you have to go back to the hospital. There's nothing I can do. You have to have surgery. So he was just like, I know Emerge can be like a bit of a wait, so I'm going to write up what's happening to you, what I found on the ultrasound. I'm going to write up your whole fertility report, and I'm going to fax it to the hospital as well. So I got back to the hospital around like 3, and I told them what was happening. I gave them the printed copy of me having a torsion. And I said, my fertility specialist said he also faxed this to you as well. And they're just like, okay. I waited in the waiting room for another hour and a half. No pain management, nothing. Nobody checked to see how it was doing. And the sonographer had already left for the day, so they had to call someone in. I was here from 6:30 when people were here. I could have been seen earlier.
Right.
So they put me in a wheelchair this time around. But all the bumps, most excruciating pain, I was crying the whole time. I thought the nurse from Emerge that took me to the ultrasound room left. And the sonographer was just like, hey, can you do all this stuff yourself? And I'm just like, I can't. So they had to get my husband because I couldn't even bend to like get my pants off by myself.
Right.
So my husband came to like support with the ultrasound, and the sonographer was just like, didn't they give you anything for pain? And I was just like, no. And she's like, I'm so sorry. This is going to be very uncomfortable.
Yeah.
So she did the ultrasound. I could see on her face that she confirmed that it was torsion. And before she let me out of the room, she was just like, you just sit tight. I'm going to go talk to the doctor right away. So they wheeled me back into a room. The physician came in briefly. He was just like, you already know what's going on. So like, I don't really need to tell you. The surgeon's going to come in and talk to you. And then even after they've confirmed that I was having ovarian torsion, I got another dose of Toradol. So there was that. And then, so that was by 5 o'clock. I was wheeled up to OR receiving, and then I didn't get anything for pain again for 2 hours. Not until 7 p.m. when I was being wheeled to the operating room, I got another dose of Dilaudid. So my last dose of Dilaudid was at 11 a.m. And then I didn't get anything else until like 7 p.m. when I was on my way to the operating room. And when I spoke with my fertility specialist after the fact, he said, when you presented, you had what we call like a surgical abdomen. So
Right.
like with the rigidity, with the guarding, with your
Guarding.
tachycardia, with all the symptoms that you were having, that should have been a surgical emergency. That should have like triggered something in your like physician's brain to say, hey, we need to do something about this. He was like, I've seen people having an ovarian torsion before, and he's like, I've had to peel them off the ceiling. He was just like, you were tolerating the pain well, but he was just like, you were still under medicated for your pain. And so the surgeon that I had was able to save my ovary, thankfully. He wasn't like a resident physician, he was like a locum.
Right.
And when I read the surgical report, my right ovary was like 180 centimeters, which is like ridiculous.
Yeah. Just the gross under medication of pain. So we know that like healthcare just on a whole has systemic failures, and they fail Black women time and time again in terms of, addressing acute pain, severe pain. You mentioned your pain was a 10 out of 10. How often do we go, oh yeah, our pain's a 10 out of 10? I'd say that we're probably pretty conservative, right? When it comes to even mentioning our pain. And if you're telling them it's 10 out of 10 and they're just not managing it, then what else is the problem? Like, I feel like I know what the problem is. Do you think it reflects a deeper, I know this is a loaded question, but does it reflect a deeper systemic devaluation of Black women's well-being?
Well, yes and yes. And I'll say that because women are already at a disadvantage in the healthcare system. We're already blown off saying like, it could be like a mental health concern. You're having a panic attack. It's just your uterus. But then take that a step lower. And then if you're a woman of color, you don't even get the same, I don't even know what the word is, but you don't get the same respect that a non-woman of color would get, right? Like you're now a peg lower. So now you're complaining. Now you're drug seeking. Now you're just demanding things that you are not entitled to, which you wouldn't be entitled to as a woman, but now even less so because you're a woman of color. And I don't want to say this is about race, but I have a colleague who presented to the same hospital that I did in the same year that I did. She's white. And she said, like, I didn't want to go to my local hospital because I know wait times are shorter here. So I drove 30 minutes to this hospital. She was like, I presented at 8 with right lower quadrant pain. She's like, I was pretty sure what it was. So like I told them all my symptoms to make them say, okay, this must be her concern. She said by 10 o'clock, she had a CT. By 12 o'clock, she was admitted and had her surgery. She said she actually tried to leave and they wouldn't let her. So she presented at 8 o'clock to the same hospital, and by noon, she was admitted to have her surgery. And I presented with same right lower quadrant pain and like no imaging, and was discharged, and nobody tried to stop me when I left, and then ended up having to come back. And I posted my story on Ona's F word page, and the comments that I read, people were saying like, oh, this is just the state of the healthcare system right now. It's not about race. This is what's happening to like all of us. And I'm like, but it is about race. And nobody is seeing that. I'm just like, just because we both had to wait a set period of time doesn't mean race is not a factor. If somebody waited 2 hours and the other person waits 12, that seems pretty discriminatory if they're presenting with the same complaints, right? Especially at the same hospital.
Yeah, and I would say that's very alarming coming from a nursing page, right? Where nurses, I would say that 9 times out of 10, the people, or I'd say 9.8% of the time of anyone commenting there is a nurse. And that's alarming. That's concerning, because if ONA and, various different nursing groups are talking about, bias and racial bias in healthcare, and you could post your story, and even though you weren't making it about race, but we know that there are racial biases. We know that, and we didn't even talk about the intersections in terms of not just, being a woman, but being a Black woman, but being like disabled, or, being neurodivergent. Like, we haven't even put those other layers on. But I find it quite concerning that other nurses would then say, like, well, this is just a failure of the system. It's like,
Right.
well, this is why we have these conversations about equity, because it's not about everybody who comes in is going to be treated equally, because at this point, even your experience wasn't of an equal state. They let you leave. Like, how different would it be for you as a Black woman to now have lost the ability to reproduce if you lost your ovary?
Right.
There's so many different stats that are tied to, Black women's maternal health, the fact, whether it is in relation to PCOS and fertility, like there just continues to show that there are different, not even just the treatments, but just our outcomes are poorer.
Right.
So for another nurse to sit there and be like, oh, this is a product of the system, shows to me that nursing has not reckoned or has fully educated or realized that the fact that it's not just about, how a system operates, but the system is what creates the inequities.
Right.
Like, if a nurse can't see that, that might not be my experience, but that could be someone else's experience, and then not put the data sets together, then that's a huge problem for nursing.
Well, that's the main problem in nursing. And they say ignorance is bliss. And for people who aren't directly affected by these problems, they're fine because they're not affected by these problems. It's the people who are that think about them day in, day out, and try to fix them over and over again. So,
well, yes, but the thing is, it's just it begs again the question of, like, what are we actually doing? Not even just within our profession. Like, if we aren't having conversations about how race can play out in a different way and how it played out very differently for you, and people can't understand that or see that, then we have a bigger problem at hand than we even initially thought of. And again, it just speaks to the fact that we are so far behind, because I would say, again, all of the data that I'm looking at, it's from the US.
yes. Well, if you don't collect the stats, you can't say there's a problem. And if you can't say there's a problem, you can't fix it. So if we collect the data, then we'll have to do something about it. We'll have to acknowledge that there is an elephant in the room. But if we ignore the elephant by just not allowing it in the room, then there's no elephant.
Well, I mean, in some cases, we might be worse off because we aren't addressing the problem, right? And again, I feel this is where, like, nursing can also be a part of this, to say, okay, here's some of the work that we can do as scholars, as researchers, to start talking about how we can change this. I don't understand why we don't collect the data. Like, there's a lot of, and I know people are like, oh, we have to do it right. Of course we have to do it right. And again, communities have to be involved, but we have to do it. Like, like, stop making excuses, put your money where your mouth is, and let's just do it. I'm going to fast forward a little bit. What was the outcome? So did you end up following up with the hospital organization with what happened to you?
Yes. So I reached out to that's the only thing I could do now. Like, my coworkers are just like, Danielle, you look great. You don't look like somebody who just went through like a traumatic event. And I'm just like,
what does that mean?
The only thing I can do is laugh about it now, because, like, I don't want to cry about it.
Right.
So I did reach out to the hospital, to their patient experience email, and I had asked for like a quality review of my chart. I had asked for a copy of my chart. I had asked for the chief of the emergency department to review my chart. I had asked for the gynecological department to review my chart. Basically, I asked for an objective analysis of what happened to me. Hey, what could have been done better? Like, what was missed? And for them to evaluate from an objective lens if racial bias was involved. The response initially was like, hey, we've received your email, just want to receive your consent to like review your file. I'm just like, okay, that was like the following day. A couple weeks go by and I get a forwarded email from the chief of the emergency department. And in regards to like my pain, me not getting any imaging, me being concerned about racial bias being involved, this was what he addressed. He basically said, "We're sorry you felt that way. We felt," is what he said, "that there's no racial bias involved in your care and that we're committed to DEI." And then in regards to my pain, he said the physician had ordered Dilaudid Q15 and that's not their fault that the nurses didn't give it.
You see how
In
quick they
terms
were
of-
to like put it back on the nurse too? Anyways.
Yeah, in terms of my pain management, that's what he said. He said, "I'm sorry if there was any miscommunication because we had a code that happened." So he was basically being dismissive and treating me as if I don't know how the healthcare system works. I'm just like, I was there. I know when the code happened. It was right next to my room. I know how Emerge works because I've worked in Emerge. I've worked in that emergency department. I know there's dedicated people to respond to a code, and the fact that we could find no one when we were looking for staff. Everybody was in that room. Every doctor, every nurse, every EDT, everybody was in that room was like ridiculous. And the fact that he's chalking it up to miscommunication because somebody was actually dying next door is crazy. He didn't address me not getting an ultrasound. He didn't address me asking for an objective review of my chart. I didn't hear anything from like the quality people. He basically addressed those like two things. Like he filtered through my email and said, "Hey, yeah, I'm just going to talk about this and this." And then that was it. So I did respond. And I was like, "Hey, like I asked about these things that you didn't address." And I'm just like, you feeling that racial bias wasn't involved is not an objective evaluation if it was or was not involved. So I listed all these things. I think I listed about 4 or 5 things. And that was a month ago. I didn't even get an email saying, "Hey, we received your email and we're following up." I got nothing, zero, nada, silence.
Well, then I think we should follow up. Like, I think this is where if people want to trust the healthcare system, if people want individuals to trust medicine, to trust physicians, then they need to do their fucking job, right? At the end of the day, they need to not just answer an email, but actually take the time to do what is actually asked of them. I question why they didn't answer anything in relation to ultrasound because again, who is the person that would be responsible for that? You did say that they did come in and they did see you.
Yeah.
So why not address their work? They had to address nursing because, of course, like we get thrown under the bus. Like, not saying that those nurses, if it was Q15 and they were not, that's on them. Absolutely. Right. But of course, like throw us under the bus, whatever the case may be. But he didn't even address the fact that he had some work in that as well. And the minimization of racial bias is like the singing tone to some of these white physicians. It's just like, never me. It couldn't be me. I've got, I watch basketball. Maybe I know an NFL player. I'm not racist. I got a black friend. No.
Yeah.
Your actions can still be racist. And the fact that he probably had his whole backup when you mentioned racial bias shows probably another piece. In the world of quality improvement, we have various different pillars that we look at. And we do talk about the social determinants of health. And by gosh, is racism a social determinant of health? Well, it absolutely is. Yep. So for them to sit there, not include you in the process, by the way, and for him to just say on his end, no, of course it's not. That means there was no work done whatsoever to examine whether that would be the case. And for him to just be like, yeah, no, he could at least have said, we can't confirm, or, there might have been, or of course, he's going to protect himself and the institution will protect themselves, even though they're inherently racist.
Yeah.
And it just makes me furious that they would come back to you and be like, of course not. No, that would never happen. But like it did happen. Question for you. Yeah. Did it ever run through your mind? Probably not, because you were in excruciating pain, to be like, I'm a nurse. What do you think about pulling that card? Have you ever pulled that card where it's just like, I've worked here, or, well, I mean, obviously not in this situation, but do you think it would have helped or changed anything?
Well, they did know I was a nurse, and that card did not help. The first thing they asked me when they were taking me off of the stretcher and when I was giving my history was, "Are you a nurse?" And I said, "Yes." It was the only thing everybody asked me. The nurse asked me, the physician asked me, anesthesia asked me, the surgeon asked me. Everyone I spoke to, they were like, "Oh, we're surprised you know how to pronounce that drug. So are you a nurse?"
You know what? Do you think they looked at you and said, she's drug seeking?
Well, I'm pretty sure they did. But like,
The fact
I
that they
mentioned that
talked
in
about
my
the way
chart
that you
as
pronounce
well.
something just starts to really make me feel like there's a lot more to this.
But they knew I'd never received narcotics before. Like when I got the copy of the Emerge note, it did mention that I was opioid naive. So that means I've never received opioids before. They were
But
aware
they
of
don't want to
that
get you to
fact.
they don't, right?
Right, exactly. That's the thing. We know you've never had it, but we're concerned that you're going to get addicted, so we're just not going to give it to you, or
Which
not in the
again is
amount
another
that you need
fallacy.
to have your pain controlled. Right, and that's why I kept getting Toradol.
That's wild. That is absolutely wild. So, how do we trigger improvement? What do you think we need to do? What do you think organizations, what do you think politicians need to know? What do you think? You were a nurse, and even letting other people know that you were a nurse didn't stop them from doing what they did.
Yes, exactly.
What do we
And
tell people?
that's the scary part. As a nurse who has the knowledge and experience, I couldn't even advocate for myself. They make that extremely hard for you to do. Even though when you know something's wrong, they look at you as if you're
You're
having like,
crazy.
yes, like I'm having a psychotic break or something. I think it needs to be more than just education. I don't think talks are going to help, not to the extent that we need the help. I think we need to start at like the baseline educational level. This is just me personally, but I know, med school, nursing school, in textbooks, they still have this misconception that, Black people don't experience pain, or they experience pain as a lesser effect than, their white counterparts. And if even though this is not like taught directly, people still have that misconception. Like if you talk to
Right.
students after the fact, they still have this misconception. They still think people of color are drug seeking. So I'm just like, we need to address racial bias at the educational level for these healthcare providers to stop it. Because I don't think that just sending them to like a cultural competency course is cutting it, because we know those people don't listen to those
Yeah, it don't
courses.
work. No.
They don't read those I-learns. Like it's just a box that they're checking, right?
Checking. Yep.
So I'm just like, it needs to go like way deeper than that. It needs to be more raw, I guess. They need to see. So like when I started in like the critical care trauma unit, my they would show us like videos of just the disparities for the indigenous people receiving care and how many people died. And nurses would be in there like just crying and like bawling their eyes out. I'm just like, this is what people need to see. They need to see like the raw effects of their actions, right?
Yeah.
So like not just with like just people of color, but with all the biases we have. Like if somebody comes into Emerge smelling like alcohol and we assume they're drunk, when they could have just been hit over the head with a wine bottle, right? Like those are all the assumptions that we put on these people, or our own biases, which nursing teaches. They teach about self-reflection and to like, check your biases at the door. But we go into the profession and we do it anyway. And then
You
we
write it
make
right
these
into the chart
assumptions,
sometimes too.
right? Yes.
Yep.
Yes. We say that they're drug seeking, and we say all these terms that we call them by, but yeah, I think it's more than just education, and I think people actually need to like see it. But I think the other problem that we're going to have is the people who need to make a change aren't being affected. So if there's no consequences for them, why would they change?
Well, this is where I think, again, like healthcare is this weird world where there's like no real accountability. There's like nobody really putting anybody, there's no checks and balances for people. So like people mess up, they say sorry, and then that's kind of the end of the road. And then it's very rare that you see lawsuits that kind of come to fruition, because again, the hospitals are more about protecting their image than they are to protect public safety. So I think you're right. Like I think for sure my equality lens comes back on, and it's like, okay, yeah, education's like the lowest rung of how people remember and do things and make change. And the highest is forcing functions and policy design. And how do we create policies that, reduce inequities? Well, even if it's a policy, like for example, just within the states, we saw the
Right.
two women very starkly going into labor and, being treated like they were like, it was the wildest thing.
Like they were invisible.
Like they were invisible. The one lady, she was laboring, left, had it delivered 8 minutes later in her truck. And now there's a law. It's I believe it's called Wells Law that they're trying to come up with. And it's essentially to do over and above the checks that you would do. And to make sure that there is a safety plan in place so this wouldn't occur again. Like these are the things that need to happen because the equality is not working. We can't do this cookie cutter approach to everybody.
Right.
We have to make sure that there are those stopgaps in place. And that organization needs to they can't look at something like this, someone's personal experience, and be like, no, you got it wrong. But there was a code.
But they can, and they did.
You need to
and there's no consequences for them doing that. And that's what I'm saying.
Social media is a powerful consequence for a lot of individuals. And I think this is where, some of this might have to go. Like, I am all for calling people out, particularly when they're not doing the right thing. And, at the end of the day, if they're willing to change and willing to do something different, like if you think about back in the days when we didn't even have social media, people were ostracized. Like word of mouth spread, and then you ostracized them and you pilloried them, and then you exiled them from town. Well, social media has a powerful way of spreading the news. And maybe just recently I talked about this with another hospital where essentially the nurses unions are like blacklisting hospitals. I think it's called gray listing.
I've heard about that.
Yeah. Gray list these hospitals. Tell nurses not to work there. Tell patients not to go there because your care will not be safe. And maybe for Black patients, we need our own little system where we say, here's our inter-community of where we feel that we're connected, where we're heard, we're kept safe, and here are the places and the voices that you need to connect with. Just a thought.
But that's also the problem because they don't want us there. So if we say that we're not going,
to be there.
They're like,
it don't
great.
matter. We make the channels and we understand what's going to happen, but we need to be there. And oh yes, there's another thing I saw. So this is the other thing that I've been seeing online too. It's kind of almost like a patient safety doula, where essentially you never go by yourself. I know you were there with your husband, but
like
it's
a patient navigator,
right? So it's like someone who is like an advocate to advocate in addition on your behalf to be like, nope, this is not how things are going. And I'm now seeing this kind of like this new kind of, I guess, profession of like, whether it's a healthcare provider, someone who's retired, that are now stepping into these roles to be like, I know this is how the system's supposed to be, and this is not it. And I'm going to advocate for this patient. And I'm like, okay, well, if that's what we need, then that's what we need to do, because we're not working on the health literacy piece. I don't know what Canada's doing in relation to health literacy. Like we're not as bad as the States, but our health literacy can be much, much better. So if we're not going to empower people to have the ability to advocate effectively, then maybe we need to find other solutions, right? So last thoughts for you. Do you expect to hear anything back from the organization? What are your thoughts?
I never had any hopes to expect anything from them to begin with, especially as somebody who worked there and saw the lack of diversity there. I didn't expect even a response. I was surprised they even responded to my email. So
that's a shame, though.
I don't expect to hear anything from them. And I did mention in my email that I was a previous employee of that hospital, and that was still their response.
Yeah, I feel like if people aren't called out, they go again just unchecked, and they will continue this behavior. And what my fear is, if it happened to you, it's happening to other people too. And that's like the worst. That is just like, even you as a nurse who's worked in the ED, who has all this knowledge, skill, and judgment, has the expertise, still wasn't able to get the bare minimum of what you should have. So what about another patient who comes in who doesn't have any of that? They get to leave with, not having an ovary,
or they become septic. Yes, exactly. Right? Like if I just got, because that's what they were doing. They were discharging me. So I'm like, if I had just like chalked it up to be like, okay, I'm just going to deal with it at home, I would have gone septic and lost my ovary. But like I had to grit through the pain to drive an hour back and forth to my specialist and back to the hospital because I knew something was wrong.
Yeah.
And I'm just like, I don't know. Like I have my appendix. I don't know what that would be like if I was losing my appendix. But they weren't concerned about my appendix because, you know, the point of care ultrasound showed that was fine. So everything
Right.
else must
But
have
the
been
fact,
fine
like, I
as
mean,
well.
we can go over the story 1,000 times. The
I
fact that,
know.
like,
I
you went to
know.
the fertility specialist and they're like, here's the torsion. And you
Yep.
went back and they're just like, here's the torsion. Like, let's just double check and
Yep.
still not managing your pain. Just,
Yeah.
it's so off. And
Yeah.
I'm sorry that this happened to you.
Me
I
too.
want to kick a can at somebody because it did. But we have to continue to, you know, have these conversations and push for change. And I will. Like, I've got nothing to lose. Like, if the worst of what I'm doing is calling out an organization for being racist, then I mean, I'm sorry. I'm if that's what you're gonna get me on, fine. It's my pleasure at the end of the day.
Yes.
But again, Danielle, thank you for coming on and sharing your story. We have a lot of work to do. We shouldn't, and that's the other piece. We shouldn't be the only ones doing this work.
No.
It can't always be us Black folk. Like, we need other folks
Allies.
that are not just allies, I'm going to say co-conspirators, like people that are like in the game that are like, I'm going to fuck this shit up too. Yes, we need those people to be like, this is not right. And it's not just about saying that it's not right. It's showing action by going to your MVP, talking to the hospital organization, showing up and like rallying against oppression. Because that's a lot of the system is about power and who wields it, right?
That's true.
So it's also about making those bigger changes and really listening. I think that's the other piece. Like, people sometimes see what people are doing, but they're not listening to what like they're saying. And you got to put the two and two together. And we're seeing a lot of like, oh man, just a lot of changes with how people are wielding power in a very different way where people are not understanding it. People need to start really paying attention. I guess it's that whole line about being woke. But yeah, I think we need to pay attention. We need co-conspirators and we need to shake things up. And I'm happy to do that.
Yeah.
Anything else that we might have missed, Danielle?
No, I mean, that's it. Let's shake some things up.
I'm ready. Thanks for coming on the Gritty Nurse podcast.
Thank you.
Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amie Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much and stay tuned until next time. Stay gritty.